Good afternoon. My name is Nikki Tucker. I'm the Director of Contracting and Account Management within Walmart's Health and Wellness Payer Relations Division. During my tenure, I've had the opportunity to do contract negotiations with pharmacy benefit managers and vision insurance carriers to assure that Walmart is an in-network provider, meaning that when you use your insurance, that you can walk into a Walmart pharmacy or vision center and be able to effectively take advantage of our everyday low prices. This afternoon, I have the pleasure of having a dialogue with Marcus Osborne, who is our Senior Vice President of Walmart Health. I should say that I've had the opportunity to learn from Marcus throughout his tenure and partner with him on a number of different projects, including Walmart's $4 prescription program, several partnerships that we have with health plans, including our Medicare Advantage program that we have with Humana, a number of different on-site pharmacy locations on employer sites, and a multitude of other projects. What I'm very happy to talk about in a project that I am glad that ultimately has launched, that ultimately launched a year ago, this week actually, is Walmart Health. So we're going to have a conversation with Marcus about the Walmart Health platform and how that has really created a new paradigm, if you will, in the healthcare delivery space. So without further ado, I'll let Marcus take it away by specifically talking about what is Walmart Health and the concept of Walmart Health. Marcus?
Nikki, thanks, and appreciate the opportunity. So what I might do is just I know we're gonna have a little bit of a dialogue and Q&A here in a bit, but what I thought I might do is just take a few minutes to talk a little bit about Walmart Health, the vision behind it, what drove us to want to progress this business and this vision, how it has manifested. And where is it going? And so I'll start there, and then certainly we can get into a little more of the details in the Q&A. But let me first start with the vision. The thing that I think I continue to be surprised by is this reality, and it is, if you ask the question, what is the one thing that Americans say is the top concern, cause of angst, cause of stress? Healthcare and healthcare related issues consistently are number one. And they have been, not just because of, certainly in the age of COVID, you would expect that. But this is before COVID. This was a year ago. This was 5 years ago. This was 10 years ago. This was 20 years ago. This has been a consistent thing. So issues come and go, concerns about the economy or jobs or terrorism or immigration or whatever it might be, other kind of big policy issues. Those issues come and go, but healthcare has been a consistent top concern for Americans. And you ask the question, well, what is it? Why is it that Americans are what is the concern? What's causing all the stress and angst? And you hit on a lot of it. I think there are a multitude of reasons, but I think if you were to kind of summarize them down, you can summarize them down into three big buckets. Bucket one is the high cost, the sense of healthcare being unaffordable, the sense that I can't afford what the care that I need for myself and my family. So we start there. Secondarily, it is this challenge of access and convenience, the fundamental belief that I can't get the care that I need for my same family in the way that I want it, when I want it, how I want it. And some of that's, related to things that, not even being able to get appointments. In some instances, it's due to barriers tied to your insurance, where you have to go through various authorization levels just to get approvals to get the care you need. In some instances, providers won't even see you because they don't accept your insurance, but there are enormous challenge to access and convenience that we see. And then the last issue is this kind of bucket is this issue around just the sense that healthcare is fundamentally viewed as uncaring by Americans, that the system is uncaring, that it's inherently complex when it should be simple. It's designed to be complex when it should be simple, that the service is poor, that people are uncaring, unsupporting. And so you put that together, you put the fact that healthcare is generally viewed as unaffordable, that it's inconvenient, that it's complex, and we shouldn't be surprised that the result of that is that we hear over and over that as Americans, we are deferring, delaying, or not getting the care that we need in the moment. And we think about that. I don't get the care that I need for myself and my family right now. What happens is downstream, the result is much higher care. Moment in time when that you have to get the care, but you're now, because it becomes emergent in need, or it becomes so your needs are so complex that it is wildly costly to the system. And we see this challenge of deferring and delaying. Certainly on the affordability side, there's a lot of reporting around that. We know in the last year, more than half of Americans delayed care because of cost, at least some portion of care they needed. Almost a quarter of Americans delayed care that they actually needed now for over a year because of it. And it doesn't matter the care category. Medical care, we see this in dental, we see it in vision care. We know people are delaying annual exams because of cost. So that is the challenge that at Walmart that we're trying to address is that people need care now and they aren't able to get it because of affordability, because of a lack of convenience, because of the complexity. And so that is really what is driving us. Walmart's business is a pretty simple one. People often use the business I think we're in. We aren't a retailer. We're in the business of creating solutions that solve for the problems that people have. So regardless of what that problem is, we view our business as how do we bring solutions to help you address the challenges you have in your life? And we do that every day, certainly through retail by being able, offering a wide array of foods at low prices, a wide array of merchandise at low prices. Nikki mentioned in pharmacy offering things like the $4 generic program that enabled people to get the medicines they need. But Walmart the vision is fundamentally about how can we do that more broadly for health and wellness services. And so that is really the driving vision behind what we're doing. And so then let me talk a little bit about then how that has manifested in Walmart Health and how we've launched. So Walmart Health is really about attacking those barriers to care that we see today. And so we'll talk I'll share a little bit more about how our approach to pricing, but it is about delivering everyday low prices on basic health and wellness to make them more accessible. It is about creating a convenient format that makes it easy for people to get the care that they need when they need it. And it is about changing the environment of how the care is delivered and how people are engaged, and giving them more support and making things really simple, and so that we generate a more what we call caring experience. So let me spend a little time. One of the big parts of what we're doing for Walmart Health is bringing together a wide array of services that are designed to address the core needs that consumers have around their health and wellness. And so that is a big part of the model. And so let me kind of walk you through the services that we started with. And these are the services when we launched the first site right about a year ago in Dallas, Georgia. These are the services that were available, that we made available in that site and continue to make available in the sites that we've launched. One of the main services is primary care. And I think often we hear, and there's some confusion, when I say primary care, I actually mean full primary care. I don't mean urgent care. Certainly We do take care of individuals who come into the centers who are dealing with urgent care type needs. So it might be, strep and flu and pink eye and those kind of things, as well as sprains and breaks and scrapes. But that's actually not the bulk of what we do. The majority of what we do is care for individuals who are dealing with chronic illness and helping them manage their chronic disease or chronic diseases, preventative services, wellness services. So that is the bulk of what we do in primary care. And that primary care services business is augmented by a full lab and diagnostic capability, by access to imaging. And so X-ray, EKG, ultrasound that allows us to also provide other services like women's health services. And so we do offer a full gamut of medical services. Beyond the core medical care, we also have access to behavioral health and mental health services in the sites. We know in the communities that we're going into that mental health services are a deep need. They're a need for across the U.S. And so if with the services we have there, if you're dealing with stress, anxiety, depression, we because of the mental health service capabilities, we have an ability to have you sit down with a counselor or a therapist and get care and get support. Beyond that, we have an array of ancillary services. So we have dental services, so full dental. We actually have optometry, vision services. We have audiology, hearing services. Outside of that, we also have access to group and community-based wellness services. So fitness classes, things like Silver Sneakers classes for seniors, access to nutritional services, access to programs for new moms, so Life with Baby programs. And we also have access to social health services. We have deployed a community health worker model in the venues and to help address some of the social health needs that we see in many of the communities we're going into. And continue to look to expand services. I'm excited in 2 locations in Georgia that we just opened with some partners. We've actually introduced access to physical therapy services, recognizing that a lot of people are dealing with musculoskeletal issues, and so creating an opportunity to help address those needs. And it's not just the wide array of services, but it's the fact that we have brought them together in one space in an integrated fashion with connectivity to the total store, to the total box. That interconnectivity is valuable really at 2 levels. Certainly on one level, it helps us we're able to operate a more efficient, effective space. There's not of a lot of administrative function work because we bring together the services together into an integrated way. But the more important thing that we see in that integration and that connectivity is the fact that these services, though across the U.S., they are often delivered independent of one another. By bringing them together, there's a lot of connection between these services, and that is often missed. That actually creates an opportunity for us to deliver more value for consumers. And an example being, it's not uncommon for our dentists to in the course of an exam that they're providing for a patient to see that patient has high blood pressure, is dealing with cardiovascular issues, that can all be identified through dental exams. And that in making that connection can help them understand some of the issues. And traditionally, if they were in a normal dental practice that was isolated, they would just say, well, you should probably go see your primary care doc. But in Walmart Health, we can actually go across the aisle and bring over a physician or nurse practitioner just to talk to that individual about what they see and what's going on and what they might do about it. And so that connectivity is hugely important. The other, we talked earlier, one of the key things we wanted to focus on was how do we deliver very clear pricing and make it really easy to get appointments. And on the pricing, to be clear there, we do take insurance. I think there's been some confusion. Is this a cash only model? It's not a cash only model. We accept today cash. We take insurance, fee for service. But the pricing was important. What we recognize is regardless of whether you have insurance or not, regardless of the quality of that insurance, that, a lot of who have insurance are operating with high deductible plans, that they have to pay for the bulk of their care. And so what we know is that, again, affordability is key, and that by coming out with a clear cash price and telling people that a primary care visit is $40 or $50, depending on the market, or a dental visit with an exam and teeth cleaning and x-ray dollars, or that sitting down with a therapist for a mental health visit is $60. That clear pricing, and knowing that the most I will pay is that, gives support to customers to know that they can afford their care, and then making it really easy for them to schedule an appointment and come in is critical as well. And then we talked a little bit about convenience and the need. How do you address accessibility? And so out of the gate, for us, we've been very focused on operating these venues for all days of the week, Monday through Sunday, delivering hours into the evening. So our traditional operating hours are 7:30 a.m. to 7:30 p.m. Monday through Saturday, and then 10 to 6 on Sunday. So what we giving people the ability to get the care they need in the evenings, on the weekends, very early in the morning, helps immensely. And so what that has done is, in the model, is by addressing these challenges of affordability, convenience, by addressing some of the barriers that cause people to feel unsupported, unserved. We've actually seen really kind of strong uptake. And the last thing I will say is the model we've had thus far, by the end of this year, we will be operating 20 Walmart health sites. The bulk of them in Georgia, which I'll come to here in a second, but we opened one in Northwest Arkansas, two opening in November in Chicago, on the south side and west side of Chicago, but 17 of the sites that we will be operating will be in Georgia. 12 of them will be the full Walmart health site that I described. 5 of them are actually tied to our older care clinics business, but we'll be bringing into the network and expanding in what we're doing in those care clinics to make them a Walmart Health Life. But for us, it's also important that we want to go in and really engage the market. And so excited about what we've been able to do in Georgia to create what we think is a network effect, where, again, by the end of this year, 17 venues where we'll have access to primary care and behavioral health and optometry and all of them, and dental and audiology and other services in most of them. And so, and the ability to really go into a broader market and address kind of the needs of communities across the way. So, so hopefully that gives you a little flavor of why we got into Walmart Health, what's sort of driven this from a vision perspective, hopefully about what Walmart Health is. But Nikki, I'll kick it back over to you and just see what kind of other questions I think we've had about what we're doing and where we're going.
Absolutely. Thank you so much, Marcus, for that overview. It was very detailed. It's fun to be on this side of the table asking Marcus a lot of questions. Usually I'm on the other side of the table. I think one of the other questions that I would like to talk about is, obviously we can't do this alone. So what partnerships, organizations, companies, entities, has Walmart Health collaborated with to make it a reality? Could you speak to those different partnerships?
Certainly. Yeah, I'd say I use this kind of term a lot. It certainly is. It originated. It was political and I think originally military in nature. But I would say that the way I described Walmart Health is it sounds like Walmart executed all this. And what I would actually tell you is the Walmart Health model is really a coalition of the willing. That this is really about a wide range of who we have had the great pleasure of working with, who've come together, who have been aligned around the vision of what we see and where we want to go, and they want to go in the same place. And so those I think those partners kind of in my mind fall into three buckets. One is there are certainly a wide array of provider partners that we have worked with. In some instances, we are doing the direct operation of the service. In other instances, we've worked with groups who have helped us to deliver the services in these venues. And so we've had partners in dental and in behavioral health and in audiology and even in the fitness. So groups ranging from Beacon Health, who's been our partner on behavioral health, to Tivity, who was our partner as we went in around fitness. So we've had a wide array of provider partners. We've also started working, and this will continue to evolve with local health systems. There are a number of opportunities that enable us, simple of engaging in a relationship that enables us, when a patient has a higher order level of care need that we can address, and we can hand them off, or we need to pass them on to that health system, making sure that handoff goes really smoothly and so it's starting there. But I think there's a broader array of opportunities that we're exploring now with health systems to think about how we can link in more strategically and create more value for customers. So I think providers are one. We started also to do a lot of work with the payer side as well. So with health plans, employer groups, looking at ways in which the Walmart Health model can help address their member and employee needs. And so have begun to do some things there. They're including some groups who are actually designing, products, Medicare products and other things that leverage Walmart Health as a core part of that product. So that continues to evolve. And then certainly there's a lot going on that we've been able to kind of leverage a lot of innovators. There, technology groups and others who are bringing forward solutions that they may be kind of they may be about one specific thing. They may address one specific need. It might be, a next generation solution in dermatology or in behavioral health, but that innovation does transform care. And so we've been able to lean into a wide array of innovators to leverage their solutions to change how we are delivering care. And so I think and I think particularly that third bucket will be one that I'm just amazed by the pace of innovation in healthcare. I think if anything, COVID has only increased that. I think people are thinking more creatively and innovatively about how we address the care needs of individuals. And so we're seeing a lot more innovation in the market. And so, anyway, but back to your question, those are probably the three types of partners that we've engaged with the most.
Can you speak to how you've been able to, in terms of perhaps partnerships that you've had to open these locations so quickly?
Yeah, I mean, I think, well, that's a good question. I mean, I think we have, again, a lot of it is been able to kind of engage with just unbelievably, one that comes to mind is we have even on the construction and the design side, we talk about innovators. There's a group that we've worked with that out of Alabama that delivered a really interesting approach where a very different design process using machine learning to optimize design, and then also using a manufactured approach to real estate, pre-manufacture parts of these sites, so that when we go into construction, where it used to be You would go in and have to spend months, hammering nails and banging around on things. We are now doing, where we actually ship in these modules, and we can construct 80% of the build occurs within hours. Be able to bring in these manufactured modules that we connect together, and the result of it is visiting two of the sites in Georgia that use that in Cartersville and Noonan. And I'm going to tell you what, the first site we opened in Dallas is a beautiful site, but it is Noonan and Cartersville. I love, they are, and it's crazy to believe that the bulk of those sites were actually manufactured and shipped in and set, and in a very quick period of time. So that's a great example of, but we've got it in other areas, technology, and we've got partners. Again, some of our provider partners have just been extraordinary to enable us to kind of move with the speed that we're moving.
You spoke a little bit about the expansion of Walmart Health in terms of the care clinic relationships that we have. Could you speak a little bit more about that? Perhaps, I know we came out publicly and talked a little bit more about our partnership with Oak Health in the Dallas, Texas, or in the Texas market. Could you speak to that model a little bit?
Sure. Well, I think what that's really speaking to is, I mentioned earlier that, that the ball, that we're structured today as we think about the customers who can use us, it's cash or fee for service. But our goal is actually to be able to build these venues and these centers, and not just these centers, everything that we deliver, we want to reach every customer. And we know that some customers, based on the plans they're on, or based on their kind of health reality, there are different models, and they are often kind of viewed as different revenue or financial models that prevail if you want to be able to truly kind of address those individuals' care needs. So you think about, and very specifically what I mean by that is you think about, particularly in Medicare Advantage side, the move to value-based care, the move to providers going into risk-based arrangements, and truly not just moving away from just episodic care, fee for service, to truly longitudinal managed care, where it's not about this visit or that visit, it's about you holistically, and how do I actually support you? And that, I think, that is that's not maybe necessary for everybody, that necessary for an individual who is in phenomenally good health, but for a lot of people, that kind of care is necessary. And so the Oak Street partnership is one that is really for us an opportunity to explore with a group who is doing phenomenal work in the value-based side, to really kind of see how value-based care works and how it kind of will work in a retail setting. I know everybody seems to believe that you just take something that works and you stick it in a Walmart and it'll work exactly the same. What I will tell you is, based on my sort of 13 years of experience, sometimes you take something that's out there and you put it in a Walmart, and it still works, but it works in a wildly different way. And sometimes it's people aren't prepared for the volume, or they're not. It's just you have to, and so it is for us. It is an opportunity for us to kind of, one, understand how value-based care works, but it's an exciting opportunity for us to find new and different ways to address the care needs of people in the communities where we live. So I think it's part of this ongoing exploration of what's possible.
Awesome. No, I think that you're right. It's basically, it doesn't work the same in every community. We have to apply our store of the community approach within the healthcare space. One of the other questions that I wanted to ask you was, how were the first several locations for Walmart Health selected. Why the move to go to look in more of a rural or densely populated market at first, and then perhaps other further expansion? Where else is Walmart Health going to open up?
Sure. So I think for us, as we've looked at the locations we wanted to go into, we actually used a model where, for lack of a better, we call it kind of net, looking for instances, assessing the net health need of a community. What we mean by that is looking at things like the ratio of primary care physicians to people or dentists to people in that community, looking at the propensity or how much chronic exists in that community. In some instances, we're able to kind of get how far does the average individual have to drive to get various types of care today. And what we wanted to do is we want to go into the communities that actually had the greatest need, that there are certainly some communities that are well served. There are a good many that are not. And I use the example of the first site we went into, Dallas, Georgia. If you look at the state of Georgia, and I think these numbers are sort of roughly right, that in the typical community in Georgia, the ratio of primary care physicians to people is somewhere around 1 for every 12 to 1,500. In the very best communities, I saw one that was 1 for every 800. In Dallas, Georgia, I think that was 1 for every 8,000 plus, right? I think Calhoun was 1 for almost 7,000 plus. And then that's not the lone factor that we use, but you think about that as a data element that goes in. Dallas and Calhoun and many of these communities were identified as having very significant net health needs. And so our view is those are the communities we want to go into because that's where the greatest need is, and there's an opportunity. There's also challenges, but there's an opportunity. So that is really what continues to drive us. I think in many ways the question of why Georgia, I think in many ways because Georgia actually represents as a state sort of a microcosm of all market realities. It's a state that has, from deeply rural areas, exurb, suburbs, deeply rural or deeply urban areas. And so you've got that, you've got uninsured, and you got insured, you got commercially insured and Medicare, Medicaid populations. It's not sort of overly skewed to any one group, but it has a really sort of nice, it's kind of, all groups are represented, all ages, all races, all ethnicities, all traffic types, all insurance types. But it was actually a really good state to go and kind of try the model because you could see how it worked with different. It allows us to see how it works with different groups, and so that was the why Georgia. Question about where are we going next? We what we have communicated is we've gone into Arkansas, we've gone into Illinois with Chicago. We have also shared that we're going into Florida next year in 2021. We'll have our first Florida sites open early in 2021. The first market in Florida that we're going to is Jacksonville. So I'm excited there. I think in a lot of ways, a lot of same challenges and opportunities we saw in Georgia exist in good parts of Florida. And so, but I think, as we continue to evolve and try to improve the model, and there's a lot that we got a lot right, and we got a lot that we didn't get right, and that we're going to have to improve and get better at, and that we're learning, and this is a learning exercise. But I'm excited as we improve the model, to think about what other markets this could go into.
So speaking of that, in terms of kind of key learnings and takeaways from those 6 locations that you have opened up, what would you say have been kind of the key learnings and takeaways?
Oh wow!
Thus far?
There's probably too many to share on this I probably the key learning, um, I guess what maybe I'll kind of not, I do this a lot. I'm going to choose not to answer your question. I'm going to answer another question, which is what has been the sort of biggest surprise, and and usually surprises are big learnings. I think
Mhm.
I was actually, when we came out of it, we stood up Dallas pretty quickly. We wanted to get something out there. Our past CEO of our Walmart US business had this quote that you get 1 point for talking about it and 9 points for doing it. So we wanted to do it. Like, let's put it out there and just see what happens. And so I think that probably the biggest surprise, and it's a good surprise, is how engaged people have been. We have seen the traffic has been strong. I think we would always love to see it more, but I think when I share some of the numbers with other groups, they're astounding. Like, those are big numbers for a site that's only been open a year. The engagement is strong. So we look at net promoter scores that are in the range of groups like Chick-fil-A, which should hit close to home there in Georgia, and Apple stores, right? So this is so
High. That's
very
high.
kind of high NPS scores. But what's also probably been the most surprising is we're seeing a lot of people, the percentage of people who are visiting us every day who had already been a visitor, who had already been a customer. So the repeat traffic. And what that's telling us is that there are a lot of individuals who have those kind of longitudinal health needs, and they haven't been able to get cared for, and that they're starting to use us in a longitudinal way. And so I think the learning there is, well, we better step up our game, because if that's what they want, then we're going to, how do we provide that support? And that goes a little bit back to the value-based work and some of the other things. But that's probably been the biggest surprise is that kind of engagement that we're seeing from customers.
So Marcus, you spoke about in terms of key learnings, even though you didn't want to answer that, but you did. Thank you. Taken away from the 6 operating sites that we have open today. Could you speak in terms of or share any customer or patient success stories? I'm pretty sure you have a lot of stories that you could potentially share.
I do, and I do, and frankly, I tend to kind of focus, instead of any one, that stands out. It's what was the story that I kind of heard most recently, and I was talking with one of the site administrators for one of the sites yesterday, and they shared a story. And I think this is just a pretty common one, honestly, where it was a story of a grandmother who had just gotten custody of two of her grandkids. The custody was sort of tied to kind of a sad thing that I think we're facing in many communities, where the parents had become addicted to opioids, and so in the course of that, she had brought her grandkids in to have medical care for the first time in a while, including getting some immunizations and some other things. And it was clear in the course of that interaction that this grandmother had been through a lot and hadn't really gotten a lot of help. And so the community health worker said, "Hey, it might benefit you to sit down with the mental health, with the therapist and with the counselor." And she did. And her comment coming out was, normally she wouldn't even have known about these services, or if she did know about them, she wouldn't have been able to afford them, and that it how much it really kind of helped her, because she wanted to be the best grandparent she could to these grandkids, and so I look at that, and I think there are lots of stories like that. Many of them have kind of quite frankly a bit of a sad kind of reality to them, but they're also, at the end of the day, they end with a bit of hope. And it is a story that if we can, I think, and it also shows the opportunity and need. If why these communities need solutions like Walmart Health, because there's often people like this grandmother who would have gone unserved and unsupported. And so I think that's the opportunity for us. But yeah, there's tons of those stories. It's a little bit at times, frankly, kind of overwhelming, to be honest with you, given the nature of some of those stories.
Well, Marcus, you spoke a lot in terms of the concept of Walmart Health, how it has evolved, success stories that you shared with patients, and looking forward to the more locations that we will be launching in the near future. I can't appreciate you enough for your time. It's, again, fun to be on this side of the table with asking you a number of questions, but also a humbling experience to know that the launch of Walmart Health is leading to ultimately allowing Americans to have affordability, accessibility, and price transparency. I like to say at the intersection of those three things creates a spark. So thank you all so much for your time. And again, Marcus, thank you so much for your time talking to us about the Walmart Health platform. Thank you.
Yeah, thank you all. And thanks to everybody.